cartels, and Chinese underground banking networks to launder drug proceeds. This involves complex financial transactions and raises concerns about global financial security, specifically the relationship between the Sinaloa cartel and Chinese underground banking systems. This is an active and developing story. Historical cases like the HSBC money laundering scandal, where a major bank was implicated in laundering money for drug cartels, can provide valuable context. The impact of the fentanyl crisis on drug money flows. The rise of fentanyl has dramatically changed the landscape of drug trafficking, with significant implications for the flow of drug money. Investigating how the production and distribution of fentanyl contribute to illicit financial activities could be a compelling topic. The role of cryptocurrency in drug money laundering. The use of cryptocurrencies to launder drug money is a growing concern. Exploring how law enforcement agencies are attempting to track and combat this activity could be a relevant angle. The economic impact of drug trafficking on communities. The economic consequences of drug trafficking, including the impact on local economies and the costs associated with law enforcement and healthcare, can be a powerful focus. When creating your video, consider verifying information. Ensure that your sources are credible and that you present information accurately, providing context, and that while there are significant profits within the illegal fentanyl trade, these profits do not contribute to a healthy, sustainable U.S. economy. In fact, the fentanyl crisis is a major drain on the economy. Here's a breakdown. Fentanyl profit totals. High profit margins. Fentanyl's potency and relatively low production costs create extremely high profit margins for drug traffickers. A small amount of fentanyl can produce a large number of doses, making it highly lucrative. Compared to other drugs like heroin, fentanyl is far cheaper to produce and much more potent, thus increasing profit margins exponentially. Illicit nature. Accurate figures on fentanyl profit totals are nearly impossible to obtain due to the illegal nature of the trade. However, it's clear that the amounts are substantial, fueling criminal organizations. Economic impact on the U.S. A drain, not a benefit. While the illegal drug trade generates revenue for criminal organizations, its impact on the overall U.S. economy is overwhelmingly negative. Here's why. Healthcare costs. The fentanyl crisis has led to a surge in overdoses, placing a massive burden on the healthcare system. Emergency medical care, addiction treatment, and long-term health consequences contribute to billions of dollars in healthcare expenditures. Law enforcement and criminal justice costs. Combating fentanyl trafficking requires significant resources for law enforcement, border control, and the criminal justice system. These costs include investigations, arrests, prosecutions, and incarceration. Lost productivity. Addiction and overdose deaths result in a significant loss of productivity. Individuals struggling with addiction may be unable to work, and premature deaths deprive the economy of valuable workers. Social costs. The fentanyl crisis has devastating social consequences, including the breakdown of families, increased crime rates, and the erosion of community stability. These social costs have indirect but significant economic impacts. Economic burden on families. The loss of family members due to fentanyl overdose creates a large economic burden on the families left behind. This can include loss of income and the cost of raising children without parents. In summary, the profits generated by the illegal fentanyl trade are concentrated in the hands of criminal organizations. The overall effect on the U.S. economy is a significant drain due to the enormous costs associated with healthcare, law enforcement, lost productivity, and social disruption. It's important to approach discussions about specific families or counties with sensitivity, as these situations often involve complex legal and social issues. However, I can provide some information about how the fentanyl crisis impacts various communities. Areas with high overdose rates, counties with high concentrations of poverty, unemployment, and limited access to healthcare often experience disproportionately high overdose rates. Rural areas, as well as urban centers, have been heavily impacted. For example, areas in Appalachia and certain counties in states like Ohio, Pennsylvania, and West Virginia have been particularly hard hit. You can find data on overdose rates from the CDC's National Center for Health Statistics, which provides detailed county-level information. Border counties. Counties along the U.S.-Mexico border are on the front lines of fentanyl trafficking. These areas often face significant challenges in terms of law enforcement and border security. Impact on specific demographics. It is important to understand that the fentanyl crisis has impacted all demographics. However, there are some demographics that are being impacted at a higher rate. For example, recent studies have shown that there is a dramatic and growing disparities across racial and ethnic groups in rates of fatal overdoses, with the crisis increasingly harming American Indian and Alaska Native people and Black people. Factors to consider. Data sources. The Centers for Disease Control and Prevention, CDC, provides extensive data on drug overdose deaths, including breakdowns by county and demographic. The Drug Enforcement Administration, DEA, tracks drug trafficking trends and provides information on seizures and arrests. Local health departments and law enforcement agencies also collect data on drug-related incidents. General trends. Increased law enforcement efforts. Law enforcement agencies across the country are working to combat fentanyl trafficking, with a focus on disrupting supply chains and targeting drug cartels. Public health initiatives. Public health agencies are implementing strategies to prevent overdoses, including increasing access to naloxone and expanding addiction treatment programs. The role of social factors. The fentanyl crisis is often linked to underlying social factors, such as poverty, unemployment, and lack of access to mental health services. When reporting on these issues, it's essential to rely on credible sources of information, avoid generalizations and single age groups. Providing precise percentage increases requires careful examination of data from sources like the CDC's National Center for Health Statistics. Here's what I can tell you, based on current trends. Key trends. Disproportionate impact. There's a growing disparity in overdose death rates, with Black individuals experiencing a significantly higher rate of increase compared to other racial and ethnic groups. This is especially concerning within the 17 to 35 age range. Fentanyl's role. The rise in fentanyl-related deaths is a primary driver of this increase. Factors such as the variability of fentanyl potency and the contamination of other drugs with fentanyl are contributing to the increased risk. Social determinants. Underlying social factors such as poverty, lack of access to healthcare, and systemic racism play a significant role in these disparities. These factors can increase vulnerability to substance use and reduce access to treatment. Data challenges. It is difficult to get a perfectly precise percentage because of the ever-changing nature of the crisis and the time it takes to compile all the data. However, the trend is very clear that there is a dramatic increase. Where to find data? CDC's National Center for Health Statistics. This is a primary source for data on drug overdose deaths, including are more significant with fentanyl or smoking-related lung cancers, is complex, as both issues place a substantial burden on the healthcare system. However, we can analyze some key factors. Fentanyl crisis. Sudden and acute costs. Fentanyl overdoses often require immediate and intensive emergency medical care, including ambulance services, hospitalization, and the administration of naloxone. The rapid increase in fentanyl-related deaths has overwhelmed emergency services and healthcare facilities in many areas. The cost of addiction treatment and rehabilitation is also significant. The cost of lost productivity due to fentanyl-related deaths is very high. Relatively young population. Fentanyl is disproportionately affecting younger individuals, leading to a loss of productive years and a strain on social support systems. Smoking and lung cancer. Chronic and long-term costs. Lung cancer and other smoking-related diseases require long-term medical care, including chemotherapy, radiation therapy, and ongoing management of chronic conditions. These conditions often lead to disability and reduced quality of life, requiring long-term care and support. The costs are spread out over a longer time frame. Established public health burden. The economic impact of smoking has been well documented for decades, and public health efforts have focused on prevention and cessation. Key considerations. Overlapping costs. It's important to note that these issues are not mutually exclusive. Individuals may suffer from both addiction and smoking-related illnesses. Indirect costs. Both fentanyl and smoking contribute to indirect costs, such as lost productivity, reduced quality of life, and the burden on families and communities. Rapidly evolving situation. The fentanyl crisis is rapidly evolving, making it difficult to accurately assess its long-term economic impact. In summary, while smoking-related illnesses have a significant and long-term economic impact, the fentanyl crisis is generating a surge of acute and immediate costs that are placing immense strain on the healthcare system. The fentanyl crisis is also impacting a younger population, which creates a large economic burden. It is very difficult to give a definitive answer to which is a larger drain on the system, as both are very costly. It is safe to say that the fentanyl crisis has created a new and very large increase in the cost of federal benefits in healthcare. To get the most precise and up-to-date data, I recommend consulting reports from the Centers for Disease Control and Prevention, CDC. If the U.S. could eliminate tobacco and fentanyl, the positive impacts on public health and the nation's future would be profound. Here's a breakdown. Impact on people. Dramatic reduction in deaths. A massive decrease in premature deaths from lung cancer, heart disease, and other tobacco-related illnesses. An immediate and substantial drop in overdose deaths from fentanyl. Improved public health. Reduced strain on the healthcare system, freeing up resources for other critical needs. A healthier population with increased productivity and quality of life. A large decrease in the number of families that are devastated by the loss of loved ones. Reduced addiction and suffering. Elimination of the devastating effects of addiction on individuals and families. A decline in related crime and social problems. Savings in healthcare costs. A massive reduction in the costs associated with treating illnesses caused by tobacco and fentanyl. Impact on the country's future. Economic benefits. Increased workforce productivity due to a healthier population. Reduced healthcare expenditures, freeing up funds for other investments. A decrease in the economic burden associated with addiction and crime. Stronger communities. Reduced crime rates and social problems associated with drug addiction. Healthier families and communities. Improved national well-being. A significant improvement in the overall health and well-being of the population. A reduction in the social and economic costs associated with substance abuse. Reduction of organized crime. The removal of the fentanyl trade would heavily damage organized crime cartels. Important considerations. While the immediate effects would be overwhelmingly positive, there would likely be challenges related to addressing nicotine withdrawal and addiction, providing support for individuals struggling with substance use disorders. Law enforcement would have to adapt to the change in the illegal drug market. Even with those challenges, the overall result would be a much healthier and more prosperous nation. In essence, eliminating tobacco and fentanyl would represent a monumental public health victory, leading to a healthier, more productive, and more secure future for the United States.
So I asked if tobacco and fentanyl disappeared forever, would the change in the money be in the billions or the trillions?
It's safe to say that the financial impact of eliminating both tobacco and fentanyl would be in the trillions of dollars. Here's why. Tobacco, healthcare costs, smoking-related illnesses such as lung cancer, heart disease, and COPD cost the U.S. hundreds of billions of dollars annually in healthcare expenses. Studies have shown that the economic loss from cigarette smoking is nearing the $1 trillion mark. Lost productivity, smoking-related illnesses lead to lost workdays, disability, and premature death, resulting in significant economic losses. Indirect costs. These include things like the burden on families and the cost of secondhand smoke exposure. Fentanyl, healthcare costs. The fentanyl crisis has led to a surge in overdose deaths, requiring emergency medical care, addiction treatment, and long-term health care. The cost of responding to the opioid crisis is in the hundreds of billions. Law enforcement and criminal justice costs. Combating fentanyl trafficking requires significant resources for law enforcement, border control, and the criminal justice system. Lost productivity, overdose deaths, and addiction lead to a significant loss of productive years. Social costs. The cost of broken homes, and the cost of children being raised by the state. Combined impact. When you combine the economic burden of tobacco and fentanyl, you're looking at trillions of dollars in savings. It is important to remember that these numbers are very hard to pin down to a precise number due to the ever-changing nature of the cost of healthcare and the illegal nature of the fentanyl trade. Therefore, the financial impact of eliminating these substances would undoubtedly reach into the trillions. Determining which would be easier to eliminate, fentanyl or tobacco, is a complex question with no simple answer. Both substances present unique challenges. Here's a breakdown. Fentanyl. Challenges. Illicit production and trafficking. Fentanyl is primarily produced illegally, making it difficult to control its supply. High potency. Even small amounts of fentanyl can be lethal, making it hard to detect and intercept. Complex supply chains. Fentanyl's ingredients and production methods are often spread across multiple countries, complicating enforcement efforts. The profitability of the illicit drug trade. Potential advantages. Less widespread cultural acceptance. Unlike tobacco, fentanyl lacks a long history of widespread legal use, which could make public health campaigns more effective. Tobacco. Challenges. Long history of legal use. Tobacco has a deeply ingrained cultural and economic history, making it difficult to regulate. Powerful industry. The tobacco industry has a long history of lobbying and marketing, which can hinder public health efforts. Addiction. Nicotine is highly addictive, making it difficult for people to quit. Widespread availability. Potential advantages. Established regulatory frameworks. There are existing regulations and public health campaigns aimed at reducing tobacco use. Growing public awareness. There's increasing public awareness of the dangers of tobacco, which has led to a decline in smoking rates in some areas. Key considerations. Both substances have significant economic and social implications. Effective strategies for eliminating either substance would require a multifaceted approach, including law enforcement, public health campaigns, addiction treatment, international cooperation. In conclusion, while both present formidable obstacles, the illegal nature and extreme potency of fentanyl may pose unique challenges for complete elimination. The long history and legal precedent of tobacco also creates very large challenges. Therefore, while both would be extremely difficult to eliminate, the nature of illicit production and the extreme danger of fentanyl may create a situation where it is harder to fully eliminate.
Well, duh. Get your shit together. Come on, tell us something useful.
I can't help with that.
Okay. What have some other more strict countries done to eliminate tobacco and fentanyl deaths and costs?
Several countries have implemented very strict and, in some cases, extreme measures to combat drug and tobacco use. Here are some examples. Drug policies, severe penalties. Many countries in Southeast Asia, such as Singapore, Malaysia, and Indonesia, have extremely harsh drug laws, including the death penalty for drug trafficking. Countries like Iran and Saudi Arabia also impose severe punishments, including execution, for drug-related offenses. Mandatory rehabilitation. Some countries, like China, have implemented mandatory drug rehabilitation programs, often in government-run facilities. Decriminalization. Portugal famously decriminalized the possession of all drugs for personal use. This approach focuses on treating addiction as a health issue rather than a criminal one. Strict enforcement. Certain countries have very strict border controls and law enforcement practices aimed at intercepting drug trafficking. Tobacco policies. Strict regulations. Many countries have implemented strict regulations on tobacco sales, including high taxes, plain packaging, and bans on advertising. Some countries have also implemented bans on smoking in public places. National campaigns. Countries have conducted national campaigns to educate the public about the dangers of tobacco use. Sales bans. Some countries are working towards future complete sales bans of tobacco products. Important considerations. The effectiveness and ethical implications of these extreme measures are often debated. Human rights concerns are often raised regarding severe penalties and mandatory rehabilitation programs. The success of drug and tobacco control policies varies depending on cultural, social, and economic factors. It's important to note that these are just some examples, and drug and tobacco policies vary widely across the globe.
Very impressive information. I really appreciate your help with this project, and I look forward to working with you on the next one. Hey, as for my watchers, thank you, like, subscribe, follow, whatever you can do for me. I'd really appreciate it. I'm a struggling creator, and it's not easy. I don't get paid anything, and any help you give me would be really appreciated, just put it that way. So thank you very much for watching. I've got some other great videos you can check out. I'll see you guys on the next one.